Welcome, my name is Anna Kraus, and if you're watching this video, then you have probably recently been diagnosed with cancer or know someone who's been recently diagnosed, and you have a couple of questions, and that's okay. In this educational video, I'm going to be talking about some treatments, procedures, and medications that can help with prostate cancer. The first two that I'm going to talk about is chemotherapy and radiation. Chemotherapy and radiation can both treat a bunch of different type of cancers, and usually if the radiation doesn't work, then sometimes they will go for chemotherapy. There are some surgical procedures that can treat prostate cancer, and the one that I'm going to be talking about is radical prostatectomy. So this is surgical, so someone who might have this procedure, you want to expect to have a Foley afterwards, so be prepared for that. And also be there for your family member, because it is a big change if it is your family member who just recently got diagnosed. And there are two specific medications I'm also going to be talking about. One is called a luteinizing hormone-releasing agonist, and there are three medications in this category. It is leuprolide, goserelin, and triptorelin. And when you're taking these three drugs, or know someone who's taking these three drugs, you want to monitor for hot flashes, osteoporosis, so report any bone pain to your provider. And you also want to monitor for any problems in your sexual lifestyle, so decreased sex drive, erectile dysfunction, and anything like that, because a lot of the drugs that treat prostate cancer affect your hormones, so that will be majorly affected. And another type of drug is called androgen receptor blockers, and there's also three drugs in this category. They are flutamide, bicalutamide, and nilutamide. And with these three drugs, you want to monitor for swollen breast tissue because, like I said previously, these drugs will affect your hormones. And with these androgen receptor blockers, you want to monitor your liver. So your provider will probably perform liver function tests regularly. So you might need to go to the lab for blood draws or go into the primary care and just get those tests run regularly, because this specific category of drugs can affect your liver. Now with both of these drugs, it can affect your libido, impotence, which basically means your sexual lifestyle. So if you're having a decreased sexual desire or anything like that, you want to reach out to your provider, because there are therapies, counseling, and other medications they can provide to help you out with this. And obviously with these medications, they're going to have their individual adverse effects, but if you have any new or worsening symptoms from your prostate cancer, please report them to your provider. And if you have any questions, please reach out to somebody. And I hope this video helps you or your family member. Thank you so much.